get us started this morning, we're just going to do the pre-exercise screening tool. So I'll just take your name down. And what's your date of birth, Gemma?
The 4th of the 10th, 1992.
92, and you are a female, and today's date for later. Okay, so I'm just going to ask you a few questions for the stage 1 of this pre-exercise screening tool.
Yep.
So has your doctor ever told you that you have a heart condition or have ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity?
No.
Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes, 1 or 2, do you have diabetes 1 or 2? No. Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity?
No.
Do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
No.
No? Okay, so what that means, because you've answered no to all of the 7 questions, and you have no other concerns about your health, that you may proceed to undertake light to moderate intensity physical activity or exercise. But what we're going to do is we're going to move on to stage 2 and see if we can get you to answer a few more questions to identify if we can do slightly more intense workouts. So what I'll have you do first is just get you to sign the bottom of that form, just to say that everything you've given me is accurate. Perfect. So I'll move on to stage 2. Got your name and your date, I can fill that out afterwards. So your age?
22.
That. You are female. So therefore, because you are under the age of 55 for a female, you don't have a risk factor in that section. Have you had a family history of heart disease?
No.
Perfect. So that's also another risk factor that we don't need to be concerned about. Do you smoke cigarettes on a daily basis?
No.
Or a weekly basis? So that's less one there too. Describe your current physical activity and exercise levels. So, how often a week do you say do light exercise?
3 times a week.
Light, 3 times a week. And what would be the duration of those sessions, do you think?
With 40 minutes each.
40 minutes. What about moderate? Do you do any moderate exercise?
Yeah, probably like once or twice a week.
So we'll go once. How long would that duration be of the moderate exercise?
Probably 30 minutes.
30 minutes. Okay, so we've got 3 times 40, which is 120, 150. Okay, so you still come in under that as no risk factor. So, do you know your height?
Yep, 156 centimetres.
Yep. And your weight?
56 kilos.
6. And we'll work out your BMI from there. Have you been told that you have high blood pressure?
No.
Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar?
No.
So we'll work out your BMI, but at this stage you've got 0 risk factors, and I can just tell that you're not over the 30 BMI, so we're safe there. So have you spent time in hospital?
No.
For medical conditions? No. Last 12 months?
No.
No. Are you currently taking any prescribed medications?
No.
Are you pregnant or have you given birth within the last 12 months?
No.
And do you have any muscle, bone or joint pain or soreness that may be worse by exercise?
No.
Excellent. Okay, so in terms of your risk stratification from stage 2, we've got a 0, which basically means that individuals at moderate risk, low risk You may participate in aerobic physical activity up to a vigorous or high intensity. So that means that we can prescribe you any exercise program of a high intensity and you'll be fit to perform that.
Yep.
So we might just have a little chat about what your goals are in terms of your fitness.
Yep.
So do you have a one short-term fitness goal that you've got in mind?
Yeah, I just want to be able to tone up a bit and just improve my physical fitness in general.
So we're looking for some overall muscle tone,
Yep.
and just a general increase in your fitness level.
Yeah.
And do you have a long-term fitness goal?
Probably the same, but just to continue to improve it as I go.
Yes. So we might general increase in fitness level. Excellent. So is there any nutritional concerns that you have that may be hindering your physical activity, or you're pretty good with that but you just like to get more consistent?
Yeah, probably more consistency and probably just watch my sugar intake.
And any aspects of your lifestyle that may hinder your exercise program?
I don't think so.
Fantastic. So I'll just have a look at my checklist here and make sure that we've covered everything. Fantastic. Okay. Thank you, Gemma.